My name is Emma. Welcome. We are looking forward to exploring the themes of family and substance use disorder in George Street Playhouse's production of Anytown. Our goal in producing Anytown is to help parents, students, and educators understand opioid misuse and substance use disorder, and how easily it can happen to anyone. Today, we will be joined by our friends at RWJ Barnabas Health Institute for Prevention and Recovery, who are experts in substance use disorder and the disease of addiction. Let's begin by welcoming Michael Litterer, Director of Prevention and Recovery. Michael, could you define substance use disorder for us?
Addiction is a chronic disease. A chronic disease is one that is treatable but not curable. And I think that's a really important piece when you're looking at the disease concept with addiction, because it's not something that can easily be stopped. It's not something that can be cured. It is a condition that individual will live with for the rest of their life.
Why is substance use disorder a brain disease?
It's very important for everyone to recognize and understand that substance use disorder is a chronic, medically recognized disease. And there is a behavioral component and a physiological component. There is actual brain chemistry involved, and then there's the behavior that brain imbalance causes. That person's brain is now saying, you must give me this substance at all costs. Then on top of that, as the brain is saying, you must give this to me, it's also saying, give me more and more and more.
What are opioids?
There is a chemical composition of an opiate, which is a substance that interacts with a certain receptor in the brain. It makes those receptors happy, so it provides some euphoria. It dulls the sense of pain and the transmission of pain receptors. But opioids are a wide variety. So you have everything from pill-based opioids, Percocets. You have intravenous morphine, both used for medical purposes when used appropriately. But then you also have opium, and you also have heroin.
Opioids have been used for hundreds of years to treat pain. The most commonly used prescription opioids are oxycodone, or Oxycontin, hydrocodone, or Vicodin, codeine, and morphine. Heroin is an opioid, but it is not a medication. Fentanyl is a synthetic opioid and prescription pain reliever. Fentanyl is 50 times more powerful than heroin. Sometimes it is added to heroin by drug dealers, causing doses so strong that people die from overdoses. In 2018, 2 out of 3 opioid-involved overdose deaths involved synthetic opioids such as fentanyl.
Someone uses opioids the first time, and they have a pleasurable experience when they use that substance. The more a person uses, the more receptors our brain creates, and the more substance the brain requires to get that same sensation.
What strategies do you recommend for parents who want to start a conversation with their children about substance use disorder?
Ask your kid every single day how their day was, and never accept good, okay, same as yesterday. We need to condition our kids from a very young age to be open and honest about what they're experiencing, because we're not going to be able to eliminate or avoid that. And it really is a protective factor about this emotional intelligence and emotional honesty to allow our kids to tell us what they're experiencing, tell us when they're sad, when they're anxious. And unfortunately, so many kids are in situations where their parents or guardians don't have the opportunity or experience to be able to effectively handle a lot of that, but more do than don't. So we really need to, one, create in the community that sense of connectedness and belonging. And within our own families, where however that family makeup is, we need to provide an opportunity for kids to be open and honest about what they're feeling and experiencing, because we're never going to be able to eliminate it, but we can help them cope with it appropriately.
Thanks, Michael. We appreciate you sharing your expertise with us. We are fortunate to have 2 recovery specialists share their experiences with substance use disorder and expertise in recovery, Angela Cicchino and Patrick Conley. What is your experience with substance use disorder?
It was a slow process for me, and it wasn't like I saw on television with the egg and the frying pan and your brain and all of those things that were being advertised to me on what that looked like. I was an ordinary kid in an ordinary town, and I started using different substances, and it was fun, and it was a party on the weekend, and it was maybe I'll do it on Wednesday night too. And before I knew it, it really became the highlight of my life, and it was something that I just couldn't get enough of, to the point where the first time I became sick from not having the drug, I didn't even know that was why I wasn't feeling well. It wasn't so much later down the road, and obviously these events took place over multiple years, but I think that the point of the vision I thought substance use was and what that looked like really kept me sick for quite a while in the beginning, because I was like, there's no way, this is not what this looks like. And I had this perspective of it, and it wasn't until like it got to the point where I did look just like that vision in my head that I was like, this is a problem.
In my 20s, after college and starting my career, I started seeing it affecting my life. You know, taking off Mondays, taking off Fridays, experiencing blackouts, being confronted by family and friends regarding my behavior as a result of drinking. And then I think I realized in my latter part of my 20s that I was addicted to alcohol because I couldn't stop. That, I think, is when I identify as having a substance use disorder or being addicted. I used various other drugs along the way that I didn't identify as having a problem with, as they were in addition to my drinking. Drinking was something that I thought I could get away with because it was accepted.
What role can a family play in substance use disorder?
When I went to treatment, I realized through the help of others how my family was actually acting as an agent of being an enabler. Once they realized that they're enabling me, helping me to get back on my feet each time I fell, wasn't actually helping me because I wasn't gaining personal strength. I needed to accept that I have a disease and take responsibility for my recovery. And I think that became a turning point.
What strategies can you suggest for parents starting a conversation with their child about substance use disorder?
I think we need to normalize those hard conversations. I think we need to talk about them all the time. I think we need to make them a part of our life because it's so important and it's affecting so many families out there. And it's so shocking to the system. But when we normalize these conversations, we decrease stigma, because that's really what this is all about, right? That shame, that guilt of, I don't want to be the drug addict. You know, I don't want to. And if we're having these conversations and we know our family members and we're able to identify, changing behaviors and attitudes earlier on, we have a better chance of fighting this together.
As we have heard, we are deeply affected by the people, places, and things that surround us. This is especially true when we are young. These factors can also influence our susceptibility to drug use. Let's take a look at some of these risk factors. Family. Genetic predisposition and or growing up in a home where people are abusing drugs or alcohol. Toward the end of the show, Hope learns that her father had substance use disorder. We don't get too many details about this, but it is important information to note. Hope was completely unaware that she was genetically predisposed to addiction. If you know that your family has a history of addiction, it's important to have that conversation early with your child. Empower your child with the information they need to make the healthiest choices they can for themselves. No one knows how substance use will affect them and whether or not they may be vulnerable to the disease of addiction. If your child hangs out with friends who use drugs or alcohol, it increases the chance that they will begin using. Conversely, if they hang out with friends who don't use, it lowers their risk. Using any kind of a substance changes the way your brain works. Whether it is vaping, cigarettes, or alcohol, using substances, even ones that seem harmless, at a young age increases the likelihood that you might use a more dangerous substance like opioids in the future. Here are some strategies for starting or continuing a conversation with your child about substance use disorder. Approach the situation as a conversation, not a lecture. Consider talking while doing an activity or driving in the car. Taking away the need to maintain eye contact can lower the pressure. Also, it's important to be prepared to answer their questions as well. Many kids will ask their parents if they ever use drugs or alcohol. It's okay to be honest, but make sure it's something you feel comfortable sharing. If you have any experiences with substances, it can be helpful to share an embarrassing story to act as a deterrent for your child. I would like to welcome Vilma Mirkov. Vilma has offered to share her experiences as a parent with a child suffering from the disease of addiction. Vilma, can you tell us a little bit about your daughter, Vanessa?
My name is Vilma Mirkov, and my daughter, Vanessa, passed away from a fentanyl overdose, a combination of fentanyl, alcohol, and I believe cocaine. She did have a creative side. She loved to, do art projects. She liked to cook, but most of all, she loved being around family. She was struggling for the time that we knew for about 14 years, and she hit many lows and kind of bounced back a few times, but never really got back to what I would say is normal.
When did Vanessa start using drugs and alcohol?
She was very private, very shy, didn't really talk much about her feelings. She was, that was her disposition. I would say that she was lonely, became withdrawn, and I'm not sure if that came first and the drug use followed, or if the experimentation with drugs started and then, compounded, her anxiety and, what she was struggling with as a young adult. She went to William Patterson. And I think that that's when I got the feeling like she may be becoming depressed. She kind of minimized, I'm fine, don't worry. And we did suspect, but she always dismissed it as bothering her or what's the matter, kind of pushing it away. I think she was huffing, as I smelled gasoline a lot of times, and I said, "What is that?" She'd say, "Nothing." I believe she was also consuming alcohol secretly. All of these things, it's all playing like a movie in my head now.
What role did opioids play in Vanessa's substance use disorder?
I believe she started using opioids was when she had like a ganglion cyst in her ankle, and she was prescribed painkillers. I feel like I could have been a better advocate for her early on had I known what the doctors at that time were prescribing, and that this would be a lifetime of, and ultimately end in death. And she was going to psychiatrists that prescribed her Suboxone, and she was using heroin at the same time. And it's all around. Like even my mom, who has struggled with arthritis, she had they gave her oxycodone, and she was able to get 3 months at a time, and Vanessa took from her.
What behavior changes did you notice in Vanessa?
It was like it wasn't her. She became someone else. I keep playing it back in my mind, what we could have done differently. That back and forth with, hardline and then, enabling and helping. I think in some ways gave us 5 more years.
What advice would you give to a parent who is concerned about speaking with their child about substance use disorder?
They should definitely reach out for support, outside of their immediate family. I would say to speak to people who really, really know the journey and who were able to, live and fight this disease and succeed. The term hitting bottom, I would say, you don't have to hit bottom if you get it early. But if you don't get it early, it's bad.
Thank you, Vilma. We are grateful to you for sharing your family's story with us. New Jersey has many innovative programs and public health approaches to help support individuals and communities struggling with substance use disorder. I would like to introduce Ocean County Prosecutor Bradley Bilheimer. As the Chief Law Enforcement Officer of this county, how are you approaching opioid misuse and substance use disorder?
So here in Ocean County, we've tried a number of different approaches to really wrap our arms around the problem. And really, we're always trying to approach opioid misuse, substance abuse disorder in innovative ways, because as times change, our approach needs to adapt. One of the programs that we've had that was very successful is something called the Blue Hope program. So Blue Hope is a program that allows any person suffering from substance abuse disorder to walk into a local police department, any one of our 33 municipal police departments. They can literally walk into headquarters and talk to a police officer that's working, sometimes the watch commander at the window, and say, I need help. They will be evaluated by whether it's Ocean Mental Health, Preferred Behavioral Health, true professionals that handle these types of individuals, and they'll get an assessment and they'll be connected to services and treatment. Right now, two of our newest programs that we started in January of 2021, one of them is called the First Step program. And the First Step program is a program here in Ocean County where we are literally following the data of Narcan reversals and trying to find the hot spots where people have been administered Narcan. Narcan is a drug that is administered to reverse the effects of an overdose. So if we see Narcan reversals in a specific town, we are centering our services with our community partner, Ocean Mental Health, to go back and talk to that person that was Narcan to offer them services. So this, the First Step program, obviously named after the idea that sometimes taking that first step is the hardest part. And for us to come to you and say, hey, listen, we see that you were Narcan. We see that you're suffering from substance abuse disorder. Here's what we can do to help you. And we literally knock on their front door. Another innovative project that we started this year is called the Camillas Project. Is one of the things I'm most proud of here at the Ocean County Prosecutor's Office. It is a program whereby which we are teaching police officers in a college setting in partnership with Ocean County College, and they are able to take 18 credits and learn about substance abuse disorder. 18 credits will let them sit for an exam to become an actual substance abuse counselor. We're hopeful that these law enforcement professionals, police officers from these local communities who have volunteered their time to become part of the Camillas Project will be able to take that knowledge not only back into their community, but back into their police departments. One of the other things that we've done in partnership with the Ocean County Health Department is we developed a series called Share Your Story, where we would invite 5 or 6 people in recovery who are brave and have enough courage to stand at a podium in front of their families and community leaders, and they would stand up and tell their story. We found that that was a tremendous way for people in recovery that had that courage to be able to stand up and educate county leaders, family members, law enforcement officials, to educate them about what happened to them and how they got to the point where they were suffering from substance abuse disorder. The common theme is that it's not that uncommon. As is explained in the Anytown play, is that really it can happen to anyone. Whether your intention was to become addicted to opioids or not, it can happen to you. And to hear people tell their stories is one of the things I find was so helpful. One of our local partners, Hope Sheds Light, they do so much work to wrap around services for the collateral consequences that happen to the family. A lot of people don't think about that. The Share Your Story campaign, you get to hear the effects when one person in a family suffers from substance abuse disorder. When one person is having that issue, it affects the whole family. And Hope Sheds Light, the Ocean County Health Department, Preferred Behavioral Health, Ocean Mental Health Services, Turning Point, all these people that we work with and we're so proud to be associated with, including my office. We're here to help the entire family, not just the person suffering. Because when one person is suffering, the entire family is suffering.
Thank you, Prosecutor Bilheimer. Opioid misuse is complex and can begin in a variety of ways. In Anytown, Hope is offered an opioid by a young man she's interested in following a soccer injury. Injuries to students that participate in athletics can require pain medication, and depending on the severity of the injury, sometimes youth can be prescribed opioids for pain reduction. Let's talk with Bill Bruno, former high school coach and assistant director of the New Jersey State Interscholastic Athletic Association. When a high school athlete gets injured, what are some of the physical and psychological challenges they experience?
I guess it all depends on the severity. The more severe, the more difficult it might be to come back. The physical part of that is the rehab. How good is the rehab? Are they adhering to the rehab? Are they being religious to it? Are they not pushing themselves too quickly to get back on the playing field? So those are all factors that hopefully the athletic trainer, the coach, and whoever's doing the rehab is constantly reinforcing that you're going to get back, but you got to be patient. As far as the psychological, there's a lot that goes into that. The self-doubt that the student athlete may have, like, will I ever get back? What's my self-worth? There's a lot of kids tie themselves into their teams. To not be part of a team suddenly, that's an emotional roller coaster that they want to rush to get back. So, yeah, psychologically, they probably push a little too soon to get back.
What pressures do you feel high school athletes experience to get back on the field once they're injured?
Yeah, they want to get back. They want to participate. Parents are going to be careful not to overdo the negativity in conversations, because sometimes when they get back in the car, parents can be the worst critics, unfortunately. Just give the kids some space and, let them come around and tell you their perspective of the game, but to be there to support them. One thing that stands out in my mind was a situation we had where a student athlete was on opioids. And quite frankly, his teammates were the ones that notified the coach, the athletic trainer, myself. We went to the principal, guidance department, nurse, called the parents, and got that young man help through the doctor. Kid was abusing him. Again, he wanted to get back on the field, be part of his teammates. He was a senior. The clock was counting. The games were getting shorter as far as how many had left. So that was a positive situation where the kids on the team stepped up to say, hey, our buddy's got a problem. We can't look the other way.
What advice do you have for parents of student athletes?
I think it's crucial that the parents and the coach, but more so the parents, know the student athlete's going through a difficult time. And they should be supportive and not judgmental, and therefore be there when their son or daughter is battling back to become eligible to get on the field.
Thank you, Bill, for your time. Remember, if you or someone you love is struggling with substance use disorder and you do not know what to do, you can always go to the local hospital and they can direct you to the resources you need. Also, if it's an emergency, call 911 immediately. Thank you for your time and participation. On behalf of George Street Playhouse, the Horizon Foundation for New Jersey, and RWJ Barnabas Health, we hope this module provided you and your family with useful information and resources. We wish you and your family good health and happiness.